for this live, I am just going to be studying for my exam that I have coming up real soon. So I'm using Quizlets. I got these questions that are supposed to be like NCLEX style questions. So I'm going to be using them for my critical care class. My school call it something else, but it's critical care. These are the questions. There's 160, but I'm not using all of them. I'm only going to use the ones that are starred. If it could show me that option. I don't see why. I have it starred on my phone, but I guess it's not starred on here, so it's not letting me do it that way. So I guess we're going to do the full 160. So some of these were for my last exam, I've realized, and then the remainder is for my current. So it's 160 questions. I really do need to get through all the questions. So let's go ahead and get started. First question is, then hopefully you guys can see this clearly. I tried to like get as close to my computer. I can't zoom in on here, but hopefully you guys can see. So the nurse noticed that a patient in the intensive care unit has lost muscle mass and tone in her arms and legs. The nurse would attribute this loss to changes in which process? Energy, catabolism, adenosine triphosphate, or anabolism. Words. So I'm going to go with 2, catabolism. So we're going to press space to flip. So the answer is number 2, which is what I said. So catabolism is a process by which complex nutrients and body tissues are broken down into more basic elements such as glucose, fatty acids, and amino acids for the purpose of liberating energy necessary to maintain body function. Patients in ICU has lost muscle tone, which is evidence of catabolism of body tissue. So perfect. So we're just going to put that as no because we know what the correct answer is. X is for things that we're not sure about. So goal is obviously to get as many in the no section. So the next one is, a patient who is being mechanically ventilated is demonstrating respiratory acidosis. The nurse suspect that which metabolic process is malfunctioning? Respiratory acidosis. Oh, I know this. So it's going to be 1. Anna, oh, wait. Oh, yeah, 3. And I just saw the answer, so I'm annoyed. Hi there. Yeah, so anaerobism is what's occurring because there's a problem with aerobic metabolism. So that's why that's the answer. Like, I just read a little too fast. I hate when I do that. Hey there. Okay, next question. A patient's blood oxygen level is measured to be 78%. The nurse implements interventions to improve. Hi, Andy. How's it going? The nurse implements interventions to improve this level to avoid development of which situation. So this one is 3. If they have a low oxygen, we don't want them to start doing anaerobic metabolism. So I'm going to go with 3. And that is the correct answer. And it just gives me the rationale. So yeah, it's saying it's a compensatory mechanism that allows energy production to proceed when energy demands exceeds the oxygen supply, such as during exercise. However, it's intended only to be temporary and cannot sustain life indefinitely. So yeah. It has been calculated that a patient in the ICU care unit needs 1,800 calories each day to sustain normal metabolic functioning. The nurse calculates out which number of calories is needed to sustain central. I don't know this, and we never were taught to do this, so I'm gonna guess. Um, I'm gonna go with 2. Oop, lucky guess. Yeah, so it's 2. Central nervous system requires about 20% of energy expenditure. The patient's daily is 1800, so 20% is 360. Nice. Learned something, so we're gonna put that over there. A patient in the ICU is surprised to learn that he has an elevated blood glucose level since he has not been diagnosed with diabetes. How should the nurse explain this elevation? Okay, many people are not diagnosed with diabetes until they're admitted to an ICU. Increasing blood glucose is the body's way of making sure there is enough energy for brain function. Many people have diabetes but are not aware of it. When stressed, the body releases more glucose into the blood, raising the blood glucose level. So the only correct answer, really and truly, is 4. Yep. When we're stressed, our body increases the amount of glucose that we use. So stored glycogen is released into the bloodstream in response to increased level of epinephrine, norepinephrine, vasopressin, angiotensin 2. These hormones that are released rapidly during physiological stress, leading to hyperglycemia as a metabolic stress response. So stress increases our blood sugar. What is this? I'm studying for my exam, nursing school. This is my last semester. A girl is graduating in a few days, and she just needs to make sure she passed her last exam in order to get out of that place and be a nurse and finally get a job and make money. Okay, next one. A patient is admitted with poor womb healing and malnutrition. To best address issues of womb healing, the nurse designs interventions to support intake of which protein. Perfect. Moving on. That was an easy one. A patient with poorly controlled diabetes has elevated lipid levels in spite of her attempts to decrease fat and carb intake. How should a nurse explain this finding? You are not eating enough and your proteins are breaking down. Your body is using your high glucose levels to produce lipids. Um, you are not eating enough carbs. Most persons with diabetes are not able to efficiently metabolize fat. Okay, let's see. Oh, they have poorly controlled diabetes, so they're often hyperglycemic. So it's 2. Your body's using the high glucose levels to make fat, right? So that was 2. Yes, so that's 2. So the liver can produce lipids from glucose through a process called lipogenesis. Perfect. Oh my god, not having to calculate BMI. That's so annoying. Wait, let's see if I remember the formula for this. So for BMI, I have to do the body weight in pounds divided by this, I think, times by 703. So wait, what was the body weight? 145. So 145 divided by, what is their height? 6 feet. 6 times 12 is 72, plus 2 is 74. Where did I put it? Oh, divided by 74. And then I think multiply by, oh, wait, no, I think I messed up. I'm like, what is it? Is this square root? I'm like, it's like a very weird formula. No, I'm like, let's see, BMI formula, because I'm confusing myself. I think I'm thinking of a different formula. If I want to use the BMI, is going to be weight divided by height in inches What is this? There's a very simple formula. I'm literally skipping this one because, again, this is also something that they're not going to ask me, but I will probably say this is probably a normal BMI. 6'2", weighing 145 pounds. That's not really abnormal. Normal. Yeah, and they're normal. But I'm going to put that in the X because I didn't know how to do the math for it. So a patient has been in the ICU unit for 10 days after a traumatic injury requiring intubation and multiple blood transfusion. The patient now has assessment finding consistent with protein malnutrition. Which lab results would the nurse evaluate supporting this diagnosis? Protein malnutrition. 1, the pre-albumin is less than 17. Perfect. Yes. Okay. The nurses explain the mechanics of collecting a 24-hour urea nitrogen test to the patient. The nurse would also explain which purpose of this test, nitrogen balance for, yeah. A patient who is hemodynamically stable has been receiving protein replacement therapy for several days. The nurse realizes that which laboratory test would be the best to determine the patient's current nutritional status. 3, transferrin. Lovely. The patient diagnosed with malnutrition and who has known exposure to candida was given an intradermal candida test dose 3 days ago. The site is currently showing no signs of induration. How will the nurse evaluate this finding? 3. A patient in the intensive care unit is at risk for developing malnutrition. Indirect calorimetry is planned to assist to estimate the patient's caloric needs. Which information would the nurse provide to this patient? You not 1. You will need no. Yes. 3. Yes. 2. I think 3 and 4. Yep. 3 and 4. A patient. Okay, I need water. Okay. A patient's respiratory quotient is measured to be 1.1. How would the nurse interpret this information? Oh, 1.1. Oh, it's 3 and 5. Oh, is it 3? Which one did I say? Oh, no, 2 and 5. Yeah, I meant 2. I said 3 by accident. Definitely retaining too much carbon dioxide, which is very much tied to the amount of carbs that they're having. Let's read the rationale. The patient is receiving too much carbs because glucose breakdown to carbon dioxide. Excessive carb intake can potentially result in carbon dioxide retention. Exactly. Respiratory quotient above 1 indicates the patient is receiving too much carbohydrates. Yeah. Okay. The nurse is monitoring a patient's metabolic status with a thermodilution catheter to determine oxygen saturation of venous blood. How would the nurse report the finding of this test? I've never even heard of this. Is it 4? It's 1. Oxygen extraction. Oh, okay. Oxygen extraction is measured with the use of a special Okay. The nurse is going to calculate a patient's metabolic needs by using the Harrison Ben. We never learned this. Okay, I'm going to X this out because this is going to ask me all the questions I don't need to go over. I'm going to have to. I do have my starred ones. Why did it not give me? I was trying to just do the star ones, but it didn't give me that as an option. What the heck? This is going to annoy me today. It's going to annoy me because I have it starred. Okay, now it has on the ones I want to actually ask me. Okay, perfect, perfect. So these are the ones that are in line with what's going to be on my exam coming up. So there's 101 in total, and I really want to get through all of them tonight. So a patient was severely injured when a building exploded. The patient pain level does not seem to reflect the severity of these injuries. How would the nurse evaluate this response? The patient is in shock and cannot respond to painful stimuli. Someone at the scene must have given the patient pain meds. The patient has increased endogenous opioids, or the patient does not understand the severity of the injury. It's going to be 3. They have increased endogenous opioids. During stress, the pituitary gland increases the endogenous opioids, which provides some analgesia, so like pain relief. Okay, because a patient is experiencing the fight or flight stage of the stress response, the nurse will be least concerned about which lab finding. So serum glucose of 80, serum potassium of 3.3, serum sodium 148, or total bilirubin of 2.4. And we don't really care about the sodium, so that's number 3. Right. The stress response result in an increased serum sodium level as the body attempts to support cardiac output. Bilirubin of 2.4 is high and should be further assessed. Serum glucose should be assessed to increase. A low glucose may indicate severe hypoglycemia. Hypokalemia is not an expected effect of the stress response. So, bam. Hi, Bray. How's it going? Okay, the nurse realizes that increased interventions to prevent infections are necessary when the patient's under stress. Which effect of cortisol complicates this risk? Increased release of histamine, increased production of eosinophils, release of immature neutrophils, or increased serum sodium level. And the answer is 3, immature release of immature neutrophils. Perfect. Yep. Okay. Which consideration will the nurse apply to the assessment of a patient who sustained penetrating trauma? The extent of injuries related to the amount of energy transferred to the body tissues. The amount of trauma sustained is related to the patient's nutritional status before the injury. If the patient was well hydrated at the time of injury, the extent will be diminished, or the primary determinant of injury is the arc traveled by the penetrating object. The only correct answer here is 1. So, beautiful. 1. Penetrating trauma refers to injury sustained by the transmission of energy to body tissue from a moving object that interrupts skin integrity. Okay, a patient was injured when the car he was driving hit a telephone pole. The patient is 6 feet tall and weighs 200 pounds. The car was traveling at approximately 25 miles per hour when it hit the 36-inch diameter wooden pole. The nurse would calculate which pounds per square inch of impact for this patient. So the way we're going to do this is we're going to multiply the weight of the patient by the speed that the car was traveling. So 200 pounds times 25 miles per hour, which would give us, so 25 times 2 is 50, and then add back 2 more zeros. So that's going to give us our answer of 5,000 pounds per square inch. And there we go. The answer is 3. To calculate pounds per square inch of impact, multiply patient's weight by the speed of the car. So 200 times 25 give us 5,000. Perfect. A teenage patient comes into the ED with an arrow lodged in his right lower thoracic region. Which nursing intervention is indicated? Have the patient assume a left sideline position and pull on the arrow to remove it. Slowly move the arrow to the left and right to attempt to dislodge it. Stabilize the arrow by patting around the wound with gauze rolls or slowly rotating the arrow to attempt to dislodge it. So for whoever is on the live, like, let me know what you guys think the answer is. Like, which one? If someone has an arrow or any like type of penetrating object in them, do you think we're pulling it out? Do you think we're turning the patient to their side? Are we just leaving it? Like, what do you think? So the correct answer is that we're going to leave it. So, and try to actually stabilize it in there. So it's going to be 3. Stabilize the arrow by patting around the wound with gauze roll. So we're going to leave the arrow inside. Yep. If the offending weapon is impaled in the body, it is critical that the object be left in place and protected from further movement until definitive surgical intervention is available. Yeah. Okay. A patient with a gunshot wound to the knee is complaining of groin and hip pain. The nurse realized that this patient's pain might be because of which effect? Cavitation, tumble, yaw, or blast effect. And the correct answer is, I believe, 4, blast effect. So tissue surrounding the missile tract is exposed to stretching, compressing, and shearing force, which produce damages outside the direct path. Yeah, so that's the answer. Moving on, we have a lot left. The nurse is prepared to assess a motor vehicle accident victim who was lap and shoulder harness restrained. Due to the mechanism of injury, the nurse will look for which most common injury. So this is important to note. So they have a shoulder and a lap harness restraint. So usually they're going to have injuries that's underneath those, whatever's restraining them. So because of the shoulder, pulmonary contusion, and because of the lap restraint, contusion of the small bowel. So it's just going to be 3 and 5. Yes. Okay, a patient is brought into the ED after a car accident. Injury includes fractured left femur, tibia, fibula, with a mild contralateral head injury. The nurse would identify this injury pattern as consistent with which situation? Ooh, unrestrained front seat, passenger of a motor vehicle, adult pedestrian hit by automobile. Oh my god, I can't pronounce words sometimes. Automobile. By a car. Sheesh, they could just make life easier. Just say car. Unrestrained driver of a motor vehicle and a child pedestrian hit by an automobile. Ooh. Left femur, left tibia. Oh, I want to say an adult hit by a car. I want to say an adult hit by a car. So 2. Oh, yeah. The injury of a fractured femur, tibia, and fibula on the same side with a contralateral head injury is an expected pattern for an adult pedestrian by a motor vehicle. An unrestrained driver would have extensive injuries to the head, neck, thorax, abdomen, and lower extremities. A child pedestrian would have chest injuries in addition to the limb and head injuries. Okay. Hi there. Welcome. How are you? Hi, guys. How's it going? So, we're doing some practice questions for critical care nursing. If you're interested, stay around. Um, a pregnant patient in her third trimester has been involved in a motor vehicle accident. Which intervention should the nurse implement to treat the patient's symptoms of hypotension? Turn the patient to the right lateral position, turn the patient to the left lateral position, place the patient in Trendelenburg's position, or place the patient in the supine. So the answer is left lateral position. So 2, yeah. So the right lateral position would allow compromise of the inferior vena cava, placing the patient in the left lateral position, shift the uterus to the left, thus preventing the heavy uterus from compressing the inferior vena cava against the spinal column and decreasing venous return and preload. Yeah, so that is that. We're going to turn them to their left side. A 78-year-old woman slipped and fell on an ice-covered sidewalk. The nurse would be most concerned that the patient has an unstable pelvic fracture if which assessment finding is present. The patient fell directly on her coccyx, so like her tailbone. The patient was incontinent of urine at the time of the fall. The patient has bruising across her labia, or the patient complains of sharp pain just above her waist. And I just was looking at this. I was looking over the slides, so this I definitely know it's going to be 3, because yes. So presence of perineal ecchymosis is an indicator of pelvic fracture, which may be unstable. Yeah. Presence of pain above the waist is not predicted. Okay, that's not important. Hi, guys. Welcome, welcome. The nurse is assessing a patient injured in a fall from a tree. During the assessment, the patient suddenly loses consciousness. Which intervention should the nurse use to protect this patient's airway? So to protect the airway, we always want to stabilize the neck. We do not want to hyperextend. Suctioning, yes. So 2, suctioning the patient. 3, stabilizing the neck. What is 4? Remove the tape. The paramedic use the tape. The patient said, no, we don't want to do that. And then pull up on the patient's lower jaw. So that jaw thrust to really help open up their airways. So it's going to be 2, 3, and 5. Yeah. Okay. The nurse has adequately managed a patient's airway, breathing, and circulation. What is the next nursing action? Well, assessing level of consciousness, administering prophylactic toxoid, tetanus toxoid as prescribed, auscultate heart sounds, assess chest for paradoxical movement. It's going to be level of consciousness. Yeah. Okay. Well, whoever is on, drop me a comment in the chat. What's up? Hi there. So, while conducting the secondary survey of a patient admitted with multiple traumas, the nurse assessed paralysis of the patient's left lower leg. Which nursing intervention is indicated? Move the patient to a semi-sitting position. Support limb by placing it on pillows. Turn the patient to assess the back, or immediately immobilize the patient. You want to immediately immobilize the patient. Stop what you're doing. So if during the complete neural exam, the patient assesses any evidence of paralysis or paresis, prompt immediate immobilization of the entire patient should occur if not already done. Yep. So that is good. So far, we've gotten everything correct, which is good. Because I've gone over the lectures like 2 times already, so I'm really trying to make sure I know this stuff. A patient who sustained a chest injury has developed tracheal deviation to the left. The emergency department nurse would provide which equipment for immediate treatment of this complication? So chest, like that, tracheal deviation means we have attention pneumothorax. To treat attention pneumothorax, we're going to use a chest tube. So it's two. Indicate development of attention pneumothorax. The treatment of this complication includes decompression with a chest tube. Couldn't have said it any different. Okay, the nurse is providing care to a farm worker who was pinned against a steel gate by a horse. Deformation of the patient's pelvis and femur is obvious, but little blood is present on the patient's clothing. Initial BP is 110/68. What nursing interventions are indicated? Select all that apply. Um, hmm. Because there's a pelvis in the femur, and these are places where you can risk for hemorrhage if there's any damage, and where he tells us there's damage, I'm going to say there's risk for bleeding. So we want to give fluids, and we want to make sure we have IV access. So 1 and 2. The patient mechanism of injury assessment indicates potential for femur and pelvic fracture, which can result in massive blood loss. The normal blood pressure may be related to pain and adrenal release. Venous access with large gauge catheters essential. This patient may be bleeding internally. Fluid resuscitation is indicated. Okay. So I think I'm going to go up to like question maybe like 30 on here, and then I'm going to go because my phone is also dying. A 24-year, and I'm on question 17 right now. So a 24-year-old woman was critically injured when hit by a car while she was walking to work. Emergency department staff has been working for 1 hour to stabilize her. Which parameters would the nurse evaluate as indicating the patient is adequately fluid resuscitated? Okay, so she was hit by a car, working 1 hour to stabilize her. Parameter would the nurse evaluate? So what tells us that she has had enough fluids? So her mapping in the 70s for 30 minutes, yes. No longer being tachycardic, yes. Her last lactate level being 2, yes. Sublingual capnography is still too high. We want that lower. It should be, I believe, below 70, so that's too high. That temperature is high. So if I did this like 98.2 for the core temp, I think that's actually fine. Or is it low? Let's see. Okay, so yeah. Temperature is not an endpoint. Okay, so we don't care about the temperature. Okay, so, and then MAP being above 70, yes. Heart rate less than 100, yes. And lactate level less than 2.2, yes. Because it was 2. Because I said 2, 3, 4 was iffy on 1, so good thing I didn't say 1. And then her last capnor being greater than 70. So like I said, it needs to be less than 70. So perfect for that. Hey, a patient who sustained multiple trauma now requires dialysis. Which information should a nurse provide about the need for this treatment? Temporary dialysis is, and this is a lot all that apply. So temporary dialysis is commonly required when patients have had multiple traumas. Yeah, the kidneys are somewhat fragile and can be stunned by trauma. No. Some of the life-saving drugs we use can be hard on the kidneys. Yes. Most patients with severe abdominal trauma have coexisting kidney damage. No. Crushing injuries to muscles can release substances that are harmful to the kidneys. Yes. So I think it's 1, 3, and 5. 1 I'm not even 100% sure of. Oh, yes. So it's 1, 3, and 5. Multiple traumas often require temporary dialysis, not permanent though. Many drugs like antibiotics, anti-steroidal, anti-inflammatory can damage kidneys. And then the myoglobins that are released from crushed muscles can occlude the tubules in the kidneys. So another reason why the patient might need dialysis. It is suspected that a patient who sustained multiple trauma is developing cardiac tamponade. Which nursing assessment finding would help to support this tentative diagnosis? So cardiac tamponade, there is a triad, it's called Beck's triad, that is associated with like the manifestation of it. So it's hypotension, jugular vein distension, and then the last one is muffled heart sound. So let's look at our options. We have flat neck veins, so no. We would have jugular vein distension, so it's like showing that it's very much prominent, right? Persistent hypotension, yes. So that's our answer, the number 2. Yep. So hypotension is part of Beck's triad, which indicates development of cardiac tamponade. And the other two things are the muffled heart sounds and the jugular vein distension. See, it says it here. Cardiac tamponade causes neck vein distension. Yep. The nurse is providing discharge care for a patient who requires splenectomy following a motorcycle accident. Which intervention is most important prior to this patient's discharge? Administer required vaccines, discuss the risk of sepsis with the patient, teach leg exercises to prevent DVTs, discuss risk and prevention of acute respiratory distress syndrome. And the answer is 1, give them their vaccines. Without your spleen, you're at increased risk for infection. So if they need vaccine, you want to give it to them. Oh, I didn't flip it to show you guys. Oh, okay. Let's go for up to 30, and then I'm going to come off here. I'm at 21 right now. A patient so far I've gotten every question correct, haven't gotten one wrong yet, which is good. A patient is in the intensive care unit with a pulmonary contusion sustained from a motor vehicle accident. Which post-traumatic complication should the nurse focus on when providing care for this patient? Abdominal compartment syndrome, that doesn't make sense. It's a pulmonary contusion, not the same thing. Sepsis, not necessarily. Acute respiratory distress syndrome, yeah, because pulmonary has to do with my lungs. That also has to do with my lungs. Or acute renal failure, no. This has nothing to do with my kidneys, so 3 is the answer. Yep, and other thoracic injury is prone to developing post-traumatic complications of ARDS and DIC. Yeah, I need to remember the DIC. Victims of a house fire. Okay, we're moving on to burns. We're getting into the burns question. Okay, victims of a house fire are being admitted through the emergency department. Of the patients, the nurse realized that which will have the greatest general risk for mortality from burn injuries. So a 25-year-old pregnant woman, 49-year-old man who smokes, 75-year-old female with arthritis, or 50-year-old male with coronary artery disease. And I'm going to go with the 75-year-old female with arthritis. She's old and she's a woman, so she has less, like, what? Fluids. So burns are going to cause her to go into a more severe hypovolemic shock. That's what I'm thinking. It is 3. People of advanced age have thinner skin with decreased microcirculation and increased susceptibility to infection. All these factors not only put them at greater risk for burn injuries, but also lead to a greater morbidity, and mortality. Okay, not the same reason I was thinking, but also still got the correct answer. The nurse is caring for a patient admitted with thermal burns. The nurse will plan to monitor the patient closely over the next 2 to 3 days for the development of which most serious complication. Okay. I'm gonna pain is you're gonna have pain right away because obviously and sometimes you might not even have pain with burns. So I'm gonna say burn shock. Okay, it is burn shock. Thermal burns produce microvascular and inflammatory response within minutes of the injury. However, the effect of these two responses can last for 2 to 3 days. Okay. Okay, this is interesting to note. Continuation of the burn process below the level of obvious injury is a characteristic of an alkaline burn, not a thermal burn, because we learned that this can happen, but my professor didn't specify like in what kind of burn. But it's good to know that it's in an alkaline burn that you see more of that wound conversion versus a thermal burn. So good to know. Okay, 24. A civilian, I don't know what I was about to say. A why is it clinical? I don't know why. A civilian patient admitted with frostbite burns to her feet is receiving pain medication and fluid replacement is being monitored for any signs of organ dysfunction. What rationale will the nurse provide for this conservative management? Frostbite injuries are not as serious as thermal or chemical burns. Nope. The extent of the injury is not obvious. Little is known about other methods to treat frostbites. No. Aggressive frostbite management is only done in specialty military hospital. Also no. So the only correct answer is 2. The extent of the injury is not obvious. Yeah. It can take weeks before there's a clear demarcation between viable and non viable tissue with frostbite injuries. Patients are treated conservatively, which includes fluid support, pain management, and ongoing assessment of organ function. Okay, dokie. A patient is being admitted for treatment of deep partial thickness burns. When doing this patient's initial assessment, the nurse expect of which burn characteristic. Okay, it's a deep partial thickness burn. You're not gonna have blisters. Um, we are probably gonna see some edema, so I would say significant edema. A leathery white tissue or erythema. I want to say sluggish cap refill, edema, and redness. The four, like erythema. Let's see. 1, 3, and 5. Yes. Oh my gosh. I was so guessing on this one. So the leathery white skin is a full thickness. Okay. Because I was like, maybe. I'm not sure. Okay. So sluggish cap refill. It can be absent. Or white leathery tissue is going to be my full thickness burns. Okay. Which is also going to be like my what? Third degree burns. My full thickness is going to be my third degree burns. Okay. We're going to see edema, no blistering, and then erythema. Okay, perfect. Good. A patient comes into the emergency department with severe burns over the face, arms, legs, and back. After spending the day boating with friends, the skin is dry and very red with brisk cap refill. How would the nurse classify this? This sounds like just a sunburn, so it's going to be like a superficial Yeah, superficial burn involves the epidermis only and are associated with burns from the sun. The burns are red and no blisters are present, right? Yeah, it says the skin is dry and very red with brisk cap refills. So, yeah. Okay. Oh, a patient has full thickness burns of the right chest area, entire right arm, deep partial thickness burns of both upper. Is it raining outside? I hope it's not raining outside. Okay, anyways, pay attention, pay attention. Okay, so we have full thickness burns on the right chest area, the entire right arm, deep partial thickness burn of both upper anterior legs. Based on the rule of nines, which estimate of total body surface area would the nurse record? I want to say, let's see. So the entire right arm is going to be 9%. The upper anterior of both legs is also going to be 9. So 9, 9, 9, that's 18. And then, so I got the right arm, I got the upper legs, and then the right upper chest. I'm going to say another 9, so 27%. Is that 27? Oh, yes, it is. Oh my gosh. Okay. So, right chest area is 9, entire right arm is 9, and then the upper legs together make it 9. Yep. Okay. Perfect. A patient is admitted with partial thickness burns over the entire left arm and neck. Superficial burns are present on the face and scalp. The anterior trunk has patches of superficial burns. There are deep partial thickness burns on the legs with full thickness burns on both feet. The nurse using the Lund and Browder chart to estimate the total burn surface will include the burns on which part. Okay, the left arm, what kind of burn was on the left arm? We don't count superficial burns. So like the superficial burns were on the face and the scalp. So we're not going to do 2. And they also had on the anterior trunk. So 2 and 5 we already eliminated because those are superficial. The legs are partial thickness, and then the feet are full thickness. So the legs and feet for sure. So 3 and 4. What about the left arm? What was the left arm? Left arm was also a partial thickness. So left arm, so 1, 3, and 4 is what we would count. We're not doing 2 and 5. So 1, 3, and 4. Yes. Okay, so we're going to do 2 more questions and then I'm going to go. I've been on for 48 minutes. Oh my gosh. The nurse is providing emergency care to patient injured in a house fire. Which patient would the nurse prepare for transfer to a burn center for additional care and treatment? Okay, so you need to have at least 10% burns. And usually if you have burns on your face or like, like very deep burns on the chest, you're going to go. So a 15-year-old with 5% total body surface area burn to the left arm, no. 10-year-old with partial thickness burns to the face and left hand. So that was a good candidate. So because they're partial thickness burns. 30-year-old female with superficial burns, no, because they're superficial. 35-year-old partial thickness burns to a part of his back. Well, it says his back, but it doesn't give us a percentage, so we're going to assume it's not a lot. And we're going to go with number 2 as our winner. Yeah. So the 10-year-old would fulfill the burn center referral criteria for transfer because the child has burns to the face and hands. Yeah. Okay, last question that we're going to do. Ugh, not more math. So this one I actually do remember the formula for. So this one, the nurse is caring for a 154-pound patient with 50% total body surface area burns. If using the Parkland formula, the nurse will calculate which amount of IV intravenous solution to provide this patient in the first 24 hours of care. So we're going to do change of pounds to kilograms. So 154 divided by 2.2. Oh, no. Okay, and then we're going to multiply this by 4 and then by, I think it was 50%. So it should be 14,000. So 14,001. Yes. So yeah, I did my math correct and I got the correct answer. So based on the formula, it will be number 1. And we just did the math. Okay, so that's the last question I'm going to do. I still have 70 questions left to go, but I think I'm just going to do them on my own. So thank you guys for hanging with me, and I'll see you guys another time. Bye, guys.